Introductions: ICT in Healthcare and Management. ICT is a subset of IT that emphasizes unified communications and the integration of telecommunications, telephone lines, and wireless signals and computers, as well as enterprise software, middleware, storage, and audiovisual to enable users to access, store, transmit, understand, and manipulate information. Healthcare, also known as healthcare, is the process of improving people's health through the prevention, diagnosis, treatment, ameliorations, or cure of disease, illness, injury, and other physical and mental impairments. Health professionals and allied health fields provide healthcare. ICT are a class of technologies that make it easier to share knowledge and information. ICT therefore play a significant part in the knowledge management initiatives. With the aid of technological tools, knowledge management project implementation has become simpler in the current business environment. Situational analysis. The growing COVID-19 pandemic has caused uncertainty in medical procedure and unreliable information worldwide. Increasing cases and deaths strain healthcare systems. Healthcare spending in Malaysia is expected to rise significantly over the next year by more than 7% to reach 75 billion ringgit Malaysia. Malaysia electronic health industry shows potential for web-based medical services. In Malaysia, electronic health refers to online healthcare provided by professional, non-professionals, businesses, and consumers. It includes educational, commercial, and informational products. Malaysia's government funding will make telemedicine and healthcare IT practical for industry growth.
Assalamualaikum warahmatullahi wabarakatuh. My name is ANISHA SHAZLIN binti SIDEK from IM401. I will explain about application in healthcare management. Nowadays, there are many applications that relate to healthcare management. As example, mobile health application, personal health record, electronic health record, and other applications. But these applications also have their own positive and negative effect to both user and providers. Firstly, I would like to explain about mobile health application. This application provide different degrees of healthcare, especially for chronic disease such as cancer and diabetes. The positive effect of using this application is the application provide electronic health records via health smart wearables. So this application will be more faster and easier to access patient health data. While the negative effect of using this application is mobile health application is lack of value. This is because other applications are more popular than this application. Next is electronic health record or EHR. An electronic health record or EHR is an application that stores patient data in digital format. So, the positive effect of using electronic health record or EHR is it can reduce medical error. So, the negative effect of using electronic health record or EHR is lack of accuracy that's caused by lack of research of data. The last application is personal health record or PHR. This application can be managed personally by the patient. So, this application provides many services such as electronic communication between doctors and patient, managing appointment, and reminder. The positive effect of using personal health record or PHR is it can reduce costs for both patients and hospitals. Then the negative effect of using personal health record or PHR is security risk. This is because the future in this application needs more patient information personal data.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad HAZWAN. So today I would like to present about my topic, which is usage of computer and devices in healthcare and management. Moving forward, the first one is medical imaging and equipment. Medical imaging and equipment is usage of computer at hospital. For example, X-ray, MRI and CT scan. So before using a computer, if the doctor want to look inside our body, they need to do some small surgery. And they also no reference for the doctor to look. But after using computer, the doctor just need to scan the area that they want to look. After that, a clear image will be displayed at the monitor. The image also can be printed for a reference. The benefit using medical imaging and equipment. The first one is the work become more easier. And the second one is the doctor become more confident to tell the patient about their diagnosis. The negative effect using medical imaging is it can be out of control. For example, the X-ray, the radiation that we make from X-ray can harm the patient, and maybe it can lead to infertile because the radiation can harm the fertilization cell. The second one is the data can be lost due to the computer being crashed. So the second one is communication and telemedicine. Telemedicine is a way that doctor can communicate with patient from wherever they are. Before using computer, if the doctor want to communicate with their patient or staff, they have to take a message or leave a note. But after using telemedicine, they can chat in real time and the information data can be delivered as soon as possible. The benefit using telemedicine is it easier the patient who is disability because they can communicate with doctor wherever they are. For example, maybe at their comfort zone, their own home. The second one is it can avoid the patient from being surrounded with sick people. For example, before using telemedicine, they have to come to hospital for a checkup. But now, they just need to communicate through computer or mobile phone. The negative effect using telemedicine is it could lead to misunderstanding between patient and doctor because they just communicate through computer and mobile phone. And not all medical checkup can do through computer or mobile phone. Some of them need a true contact between patient and doctor. I think that's all from me. Thank you.
I will present about recommendation for ICT in healthcare and management. The first is to reduce the internet digital divide. The health management information system should be focused to collect data that is of local relevance and developing capacity for health workers to use data for planning and a day-to-day decision making. There is no need of aiming at having a computer for each facility unless we are sure that health workers will make a better use of them in improving the quality of care to the people they serve. Ignoring the requirement of the rural community who are the majority perpetuate the rural-urban divide. Therefore, in the development of communication system, emphasis should be put on the need to utilize traditional media that have potential to reach large number of people. The second is about role of private sector. With the current economic situation, the private sector will continue to play a major role in the efforts to spread ICT technology. But currently, most investors shy away from investing in rural areas due to unfavorable conditions such as low purchasing power and high investment costs in areas with lack of erratic supply of electricity and shortage of telephone lines. The profit motive in the private sector cannot work unless deliberate efforts are taken to create a conducive environment for investing through the establishment of favorable government policy and infrastructure. There is therefore a need for poor countries to exercise strong commitment and political will to bring in favorable conditions for investment in the rural areas by encouraging the development of low-cost access technologies that address the needs of the rural majority. To summarize, technology is changing the landscape of the world and leading us towards a sophisticated technical world. The emerging role of ICT has created a huge impact on healthcare. It enhances the quality of care, increases the patient security and data protection, and reduces operating and administrative costs. The telecommunication devices are more user-friendly and used by a huge population around the world, which have reduced the communication gap to a zero level. Therefore, accessibility to information has become simple using ICT, and also people find themselves more relaxed while availing healthcare service.